So, as our director of global programming said this morning, good morning, good afternoon, good evening, wherever in the world you might be. Thank you all so much for coming back to the 2020 Concordia Annual Summit, our 10th annual summit. And this morning we talked about the state of the elections and civic engagement. Midday today, we heard from Bob Woodward, interviewed by Frank Luntz. And now we're going into one of the other massive issues facing not just the United States, but the world, which is the fight against COVID-19. And it is my great pleasure to welcome to Concordia for the first time Mayor Cassandra Franklin of Everett, Washington. Cassie and I met actually 2 years ago. I think it was now at the Joint Civilian Orientation Conference, what's known as JCOC, which is something out of the Secretary of Defense's office, and it's a 1-week immersive course in all things U.S. military for people who are not in the military. And I remember it was both one of the most fulfilling, but also one of the most intense weeks of my life. But one of the great pleasures of it is I got to meet Cassie. So thank you so very, very much for joining us today.
Thank you so much for having me. It's great to see you again, even virtually.
Exactly. So Everett, Washington, as most people know, is the community and the city that saw the first recorded case of COVID-19 in the United States. And so while it's still unknown if it was perhaps existing elsewhere prior, the first official case of COVID-19 was in Everett, Washington. You are the city's leader. Can you talk a little bit about what it has been like to be not just on the front lines, but on the front line of what is now this pandemic sweeping across the country and around the world?
Well, I think it's been so much like what other people are experiencing. You know, the world shifted this year, and in January it was kind of that slow start. We got that first case on the 23rd of January, the first known case. And then I was looking back kind of over the timeline these past few months. And March, it really kind of grew to this urgent status where we declared an emergency. We were working with the governor's office and other leaders across the region to first debate and discuss whether we should close schools, and then close schools, and then moved into, I issued a stay home directive asking my residents to stay home. I was the first in the state to issue that, and then the governor's office 3 days later followed suit. And I think that those actions successfully, kind of saved lives. But I feel like the world has become this different place. You walk outside, the things that we do, the way we do things, the way we engage as a community has completely changed from what we could have imagined when that first case hit in January. And we kind of successfully kept it from spreading on that one case, but by the time we realized there'd been community spread from other asymptomatic people, it had already, kind of reached to a point where we were seeing what other communities were seeing across our country and around the world.
Can you take people through a bit? We have thousands of participants participating in this summit on the platform, and then we have an additional very, very large group participating from around the world on the live stream. This is the largest summit to take place parallel to the United Nations General Assembly. So normally we'd all be in New York meeting at this critical time. Obviously can't do that in person. One of the things that I wanted to come from this conversation is for people to understand what it is to be a local leader in the era of COVID. And so if we go back to January, talk a little bit about how you make some of those decisions, because surely there are so many different factors that go into it, yet probably publicly in the way we read in the media, it sounds like such a simple decision to make. Can you talk a little bit about that decision-making process for you as the mayor?
Sure. I think when that first case hit, I was actually in Washington, D.C. at the U.S. Conference of Mayors, and I, was kind of overwhelmed to be not at home when we were seeing that first case in Everett. And when I flew back 2 days later and began to have internal meetings with my Office of Emergency Management and my fire chief, we began to plan for what it could be, hoping that it wouldn't turn into a pandemic because we hadn't used that term yet, but knowing that there was some risk. And so we began to have weekly meetings. I'm fortunate to have really skilled team around me in emergency management, and I think they were overly cautious and overly prepared, which helped us a lot. I
Mhm.
authorized kind of early orders of PPE and things like that, and then our team started using it before it became common. The the real shift happened, I think, the end of February, early March, where we started seeing the cases pop up around the region, and we started to have those calls with other mayors and the governor's office. And those were difficult calls. None of these decisions were easy because there's no good answers. There's no, we were kind of driven by decisions to save lives. That was kind of the first thought. How do we save lives? Each one of these people that have died due to this virus is a tragic loss of not only that individual, but their family and the community around them. And so how do we save lives? And so you're kind of rushing, watching what's going on in other parts of the world, and the cases that we were in other countries, and the overwhelmed healthcare system, and how can we ensure that that wouldn't happen here locally. So really leaning on the experts, we made those kind of cautious steps, and had some really tough conversations with fellow leaders on what was going to be in the best interest of our community. And ultimately, I think our state has done well, but we've still lost far too many lives. And then, of course, you have the impact on the economy. So the moment we started to issue kind of stay home, like closing the schools, or stay home directives, those types of things that here, whether at a state or a local level, we started to get the pushback for, well, we have to open up the economy. And that push and pull between public safety and the economic impact is very real. And as a local elected, I hurt for every family that has lost a loved one, and I hurt for every business that has suffered just incredible financial hardship during this time. So it has been, those have not been easy decisions. They've been really difficult decisions without ever enough information to know that you're making the right choice.
So when you're dealing with a situation like this, and I think you raise this point of, yes, health comes first. There's no question that people's health comes first, but there are other factors at play that we have to think about at each stage. And in this environment, and when we had our opening session this morning talking about the state of American politics, the presidential campaign, there we're seeing that play out on the open stage. It is this or that. There seems to be the loss of nuance or perspective or respect of the complex. So when you were starting to reopen the city, how did you look at that with that balance of people's health, but also the urgent need for businesses to survive?
Well, I think we first, working closely with the governor's office, working closely with the health departments, and listening to the experts around us is absolutely essential. But we put together a Getting to Safe toolkit for our local businesses. It's been translated in dozens of languages to help businesses reopen. And you think about, there was a number of essential businesses that had to remain open, and there was so much we could learn from those operations, whether it was a hospital or a grocery store, of what steps they took to put in place to keep the community safe. And so translating that and trying to implement that in other businesses, but then working with the governor's office when we saw things that could be further opened, so this doesn't make sense. And so working with different members of the business community to advocate for changes in the reopening plan. And I think the Governor Inslee has a phased in approach, which makes a lot of sense. There's 4 phases to reopening, and different parts of the business community come back into operation once the case counts go down. But I think the real challenge we found is the case counts haven't been gone down. And so now it's like, how do we live with this virus? How do we safely, fully reopen our economy, and knowing the risks here? And so that push pull between public health and safety and the
Mhm.
economic impacts is very real. And then on top of that, I would add, now we've got the emotional, mental concerns for mental health and the isolation. People aren't made to be isolated for months at a time. And so we're seeing some real concerns. And I think September is Suicide Awareness Month, and that's actually very important right now because people have been so isolated. So what can we do to take care of the health and well-being of our community on an emotional level as we struggle with this pandemic?
So Everett is home to the largest manufacturing plant for Boeing,
That's correct.
correct me if I'm wrong, the second largest hospital system in Washington State, I think,
I believe
right?
so. Yeah.
And
Yeah,
a significant military base.
that is
Those are
correct.
all So those are all three uh, employment centers where people had to keep working through the pandemic, right? So how is it that you manage both that element of executing on policy, but also for other parts of your community that might have come under stiffer or stricter restrictions?
That was incredibly challenging. Most of Everett's employees are essential, and so to have Boeing operational, our hospital, our naval base operational, and then have all these small businesses have their doors closed was really a challenge that we had to work through. I think Boeing ended up actually closing their plant for 2 weeks
Mm-hmm.
and putting protocols in place because they were having some challenges in kind of keeping the spread of the virus down, and that closure allowed them to put systems in place, and some of those systems helped us then advocate for changes in the phased reopening plan where we could help other small businesses reopen. But I think as a local leader, our focus has been what are the tools that we can put in place. That's the governor and the health department's job to decide when and how something can reopen. We can advocate and work with them, but what are the tools that we can put in place for these businesses that were struggling? And so, the business grant programs, the Strudery programs, the different online platforms that we made available to help these businesses
Mm-hmm.
through it. But I think that has been the real challenge of this pandemic is quote unquote essential operations and trying to designate what's essential and what's not when so much of it is dependent on each other, right? The supply chains really require multiple businesses to be open. We had a toy manufacturer distribution plant which was open because the when they distributed the toys, those cargo containers actually were used for essential items as well. So we had to keep that distribution center operational as well. So it was a really interesting challenge to also even articulate these nuances to our residents that it just don't quite, understand the impacts of all these different decisions that were had to be made.
I think I speak for a lot of people when you see in the news and you see press conferences, and I'm down in South Florida, which obviously has been on the front lines of this in a huge way as well. And you see your mayor, you see your governor, you see the president, you see members of Congress talking about these different issues, giving these formal press conferences. But I'm always sort of fascinated to know what it has been like on a personal level. And I hope you don't mind me asking this question. We didn't do really a lot of prep for this conversation because we wanted it to be really a conversation between two friends. But what has this been like on a personal level for you? What has this felt like? You're a mom. What has this been like?
This has clearly been the most difficult year of my professional career, of my life, and really tests your leadership. And it is hard to even think about the personal impact because of the stress of the job requires um, that high performance place all day, every day, as you're trying to work and make decisions on behalf of your community. But I think
Hmm.
I've been filled with grief for kind of what our country has been going through these months, and the loss of
Hmm.
life and the loss of livelihood that we're seeing, and then just the loss of faith in kind of our systems of government, which is really hard then
Hmm.
as an elected leader. As a mom, I just like other moms, I'm worried about my kid. She's a only child, and she was, pretty much completely isolated from March on, and is now starting school, sixth grade, middle school online, and at a time in her life where her whole job is socialization and getting to know who she is with is in relation to other kids. And so I think that I have a great level of empathy for what other folks in my community are experiencing, but it's hard to kind of even get to that point. Because the kind of the grief and trauma that we are all experiencing in our own isolated worlds, it makes it really hard to connect on that personal level.
Well, Mayor Cassandra Franklin, thank you very, very much for joining the summit. It means a great deal to all of us. You and I were just catching up maybe a month and a half ago, and I got off the phone and immediately thought this needs to be the start of our conversation as we talk about the role of the public and private sectors in combating the pandemic. And so thank you so much for your leadership and for being a public servant and being in government and for everything you do on the front line. So thank you. It's really, really good to be with you.
Oh, thank you so much for having me. It was great to talk with you today. Thanks.